Hello and welcome to Medical Dialogues. I'm Mr. Zaman and today I'm going to talk about better radiation protection needed in female health workers to minimize breast cancer risk. Women working in healthcare who are regularly exposed to radiation from X-rays and other imaging procedures need better ionizing radiation protection to help minimize their risk of developing breast cancer, argue the doctors in the BMJ. Personal protective equipment or PPE such as lead gowns are used to shield the body from harmful radiation during these procedures. But studies have shown that current radiation PPE provides inadequate protection to breast tissue as it leaves the area close to the armpit, known as the upper outer quadrant and axilla, the most common site of breast cancer, exposed. They point to observational evidence suggesting an increase in breast cancer risk among female US orthopedic surgeons compared with an age-matched female population, and to a small Finnish study showing breast cancer at 1.7 times the expected rate in radiologists, surgeons, and cardiologists compared with female physicians not working with radiation. In a study using artificial female torsos to measure radiation exposure, researchers found inadequate upper outer quadrant protection and no statistically significant reduction in dose when standard PPE was compared with a torso without PPE. Occupational radiation exposure has not been identified as a risk factor for male breast cancer. However, the Ionizing Radiation Regulations 2017 state that the radiation dose delivered to all workers should be as low as reasonably achievable, or ALARA. The most effective way to achieve this, say the authors, is by reducing the duration of exposure, increasing the distance from the source, and shielding all workers with effective PPE. They point to additional protections such as cap sleeves and axillary wings that can be worn under standard gowns to protect the upper outer quadrant of the breast, and say the European Society for Vascular Surgery 2023 clinical practice guidelines on radiation safety have already recommended female operators consider adopting this extra protection. That's all for today. Stay tuned to Medical Dialogues for latest updates.
Never miss a medical update from Medical Dialogues. Like, subscribe, and press the bell icon.